Again, management of care in the section of the E's down here by ethics. Let's take beneficence first. Beneficence means to do good. Okay, it just means to do good. Now, one of the things I tell you with this one is I do it every day. An example of that is giving patients a warm, cozy blanket when they come out of the OR. That is beneficence. Another one is pain meds. That is beneficence. Highlighted. These are on the test exactly like I'm saying them. Highlight that bad boy. Another one is patient teaching. All the teaching you do is beneficence. Okay, so I put patient education. Y'all help y'all cousins. It is 3 pages in, if you're looking to see where are you. It's 3 pages into the packet. Okay, non-maleficence means do no harm. The number one example for this one is taking defective equipment and removing it from the patient area. Labeling it, calling the people to come fix it. That's number one on the test. Another really popular example of non-maleficence is 2-person ID. So name and birth date ID bracelet, right? So you have to know when you do the 2 patient identifiers, that is an example of do no harm. Okay? When you're scanning meds, that's another example that was on the test. Scanning all meds is another example of non-maleficence on the test. Okay, veracity, here we go. This means to tell the truth no matter what. I told you about Dr. Fauci and the little mask. He might have thought it was for a good reason, but he fucked it up because now he wasn't being trusted. Tell the truth no matter what. What difficult situations have I been in and you might be in? Oh, honey, the number one is the patient will tell you, the family will tell you, don't tell her she has cancer. My patient told me, my mother-in-law works in labor and delivery. She's not stupid. She knows there's only certain reasons for a C-section. Can you please tell her that I got a C-section because I was breech? Now, meanwhile, you got a C-section because you had an active herpes lesion on your cervix. And no, I am not going to lie to your mother-in-law. I'm not going to lie to anybody. But specifically, I'm not going to talk about any of this with your mother-in-law. And this was before the days of HIPAA, so there was no such thing as HIPAA. So you really didn't even have a law you could say, because of the law, I can't discuss this with you. I just know I'm not getting ready to talk about your daughter-in-law with you. I'm not going to do that. You need to talk to her about that, okay? But her daughter-in-law was so scared. She asked me to lie, and there's no way I would, okay? So veracity just means habitually, continuously telling the truth, okay? The next one is fidelity. This is keeping your word or your promise. Nurses break this all the time. I'm sure I have as well. So what are examples? Okay, baby, when I get back from lunch, I'm going to change that dressing. You come back from lunch with an admission from hell. You never got back in that room to change that dressing. You literally have violated the ethical principle of fidelity. Now, are you going to jail for shit? No, it's an ethical principle. It's not a law. But it's an example to know what you probably better think twice about saying, because you might not get a chance to do it. You want to, but you might not get a chance to do it. So be very careful what you promise the patient, because they're going to remember you promised it.
I'll be late. I just got to get it done, because I hate making them think that I'm going to do something.
No, honey, you're not able to get it done if your ass is sitting up there with an admission from straight hell. You're not able to. I promise you that. Especially when the hour turns after midnight. Okay, and all the freaks come out at night. Now, justice. The word justice means fairness. I read to you a New York Times article pointing out the unfairness of organ donation. It noted that Asian and Caucasian men got organs more than anyone else. Now, there's two parts of that coin. That's true, and that's a violation of justice. But another part of that coin is black people ain't donating their organs. So what ends up happening is when we try to find a match for your kidney, like my student been waiting for 3 years, the match is always going to be an easier match if you're black like they are. So if you're not, but this article was truthful in the sense that it did the research. It had nothing to do with a match. It had everything to do with you were full of shit and violating this ethical principle. In other words, you were a match and you got overlooked for that other person. Whether it was your doctor didn't fight for you or whatever it was. This was recent. I read this to you. It was in the New York Times, which is a very reliable source. Now, so violations of justice, organ procurement, uninsured, you holding out a VIP room for your friend, all of that is a violation of justice, okay? It happens, we know it, but it is a violation of justice. In other words, fairness. Justice means fairness across the board. An example of fairness across the board is the sliding scale fee for services that we have here at Metro Health. That's a good thing. Autonomy. This means that your patient, no matter what, has the right to make decisions about their health care. And you can't judge them. You can't be tripping on it. It's whatever they want to do is cool with you. Stop tripping on it. If they don't want that procedure, they don't want that surgery, they don't want those meds, that's the business. Okay? Advocacy is you fighting for your patient. You know that they're not going to talk to the doctor about this, but it's imperative that you do for their health. That's being an advocate. It's recognizing and speaking up when shit ain't been done right. You're going to see yourselves do that a lot when it comes to pain management in minorities. Brown and black do not get their pain treated. So many of the times we are speaking up for these patients, whether you're white or black, you're speaking up for the patient like, excuse me, she said she's in pain. Can we get something ordered for her, please? Oh, okay, well, sure. That's how they say it, too. Well, sure, whatever you want. Okay, now, the next one, if you look at your page 14 on your Oh My God packet, because we're about done. If you look, it says Good Samaritan law. I need everybody to remember that if you stop to be a Good Samaritan at the scene of an accident, you must stay with them until the ambulance arrives. In other words, it's a big old blizzard out there, 16-car pileup. Your job, you were supposed to be at the job at 7 p.m. You see this horrific accident. You know you have the capability of helping somebody. You stop to help them, and one thing leads to another. It's getting late, and you want to leave? I don't think so. You're not going nowhere till the ambulance arrives, because then that's abandonment. Okay? Do not take pay when you call yourself being a Good Samaritan. You do not take any kind of pay, or now you became a legal nurse and can be sued for whatever. Remember on your test, and yes, this is always on there, torts and civil law. Please highlight that. Torts and civil law means lawsuits. Informed consent, select all that apply. Look what I wrote. The provider, not the nurse, has the responsibility. It can be revoked at any time. So what, I signed it. I don't want that now. You better let me up off this OR table. That's exactly the truth. It don't matter what they sign. If they say no when the procedure gets ready to be started, no means no. Okay, so it can be revoked at any time. It must contain the risk the benefits and the right to refuse and alternatives along with the provider performing the procedure and the purpose of the procedure with the prognosis if it's done or declined. Now, most things will be very easy to read and very clear. The patient needs to sign prior to medications. If they're illiterate, it must be read to them. You can't sign anything you can't read. Come on now. Medication reconciliation, and to all of you looking at the clock, that clock is purposely fast. Medication reconciliation, you are comparing their homegoing meds with what they were on before they came into the hospital and with what they were on during the hospital stay. You'd be surprised at how different that needs to look. Okay, then you see that the patient cannot take their medications from home without an order. So a lot of our patients be like, can I take my own prenatal vitamins? Yes, I'll write an order so the nurse knows it's okay. They can take their own meds, but they have to have an order. If a patient leaves AMA, this is probably one of the more important issues because it happens every day. If a patient wants to bounce the fuck up out the hospital, if they want to leave AMA, you have to look them in the eye and you have to say the words a little something like this. Okay, I get it. You're tired of this shit. You want to leave. You want to get out of here. I get that. I'm a little bit worried, though, and I have to inform you that if you leave the hospital at this time, there is a risk that you could die. Yes, I said it, and you better say it. That you could die from this condition without the proper care. You have to document that you said those very words. Now, many of you are confused. You have said to me, oh, and they got to sign that paper too. They ain't got to do shit. And many of them will leave before you print that out for them to sign. But it's nice if they sign it, but don't get it twisted. You can't keep nobody in the hospital talking about, wait, you got to sign this paper. No, they don't. No, they don't. You are going to also have to remember the second, let me be clear, the second the patient say they want to bounce up out of there, you have to let them know, okay, I get it. I'm going to let the doctor know right now that you want to leave, and he'll come down and talk to you if you like. But yeah, I get it. But I'm going to let them know, and I do want you to know I'm worried about you, because if you leave basically on what you were admitted with, there is a chance of death if you leave and you don't get the proper care. Okay? Now, you don't say that if their toenail broke. You say that with real serious shit, right? If somebody came in your ER for a pregnancy test and they sitting there forever and ever and ever and don't get it, and they be like, fuck y'all, and leave, like on Nurse Jackie, if they do that, I'm thinking you're good if you didn't notify them they're going to die without a pregnancy test, because that wouldn't be true anyway. What conditions are we talking about? Pelvic pain, back pain, abdominal pain, and headaches. Know those. Okay. Last but never least, you can see that there are a lot of legal acts. It's called EMTALA, which means Emergency Medical Treatment and Active Labor Act. Active Labor Act on your test is going to be the patient is 4 centimeters. That's going to be 4 centimeters for your patient. Active labor, 4 centimeters. If therefore, see, this doesn't have any meaning to you because you didn't live as long as I did, but some of y'all that's in the front seat that lived as long as I have or close, you remember what life was like before Obamacare. They would take a patient coming in there 8 centimeters about to have a baby and kick her out in the streets to deliver. They would take patients having heart attacks, look at what insurance they had, or if they had none, bye Felicia, you can't be here. It was all based on your insurance. It's illegal now to ask to see the insurance before you take the vital signs. But that's what used to happen. And lots of people died. So this law was passed to protect them. Self-Determination Act, the right to refuse anything, that's called autonomy. HIPAA, you guys know this, but make sure you also know, just like they have a right to have access to their records within 24 hours of request. Hospital personnel can only verify a hospital admission. They can't verify anything else. They can only verify the hospital admission. Risk management, negligence, malpractice. Remember, your risk management means lawsuit prevention. That's what that means. Risk management means the hospital is trying to prevent a lawsuit. In that situation, an incident report can be filed whenever there is a medication error, a fall on the unit. There's a lot of different reasons. Something's done wrong and it ended up being really ugly. You write an incident report, but look what I wrote. It says, and I quote, never copy. Never mention it in the nurse's notes and never file it in the chart. Now, we off tape. We off our little paper. We're done now. Let me give you some facts of life. Facts of life is you do not want to go out of here unless you are an independent provider and buy malpractice insurance, because you will become a target for the lawyers. Here's what I mean. If you work like any other nurse at the Cleveland Clinic or Mayo Clinic or University or Johns Hopkins or any other place like that, or a nursing home, do not go out of here and go get some malpractice, because now you are going to be the biggest target for any lawyer in a lawsuit. Here's why. Whatever you do, you're supposed to be protected by a hospital or the nursing home legal people. They will work hard to protect you because you are part of the hospital. When you take out a private policy, now the lawyers look at the hospital and they say, oh, I can get paid from the hospital, and she got her own policy. I can get paid twice because she got her own policy. I'm going to go after her hard. You seen the patient for 15 minutes. You took care of the patient for 6 hours. You only took care of the patient for 15 minutes. She don't have no hospital, no private malpractice policy. You do have a private malpractice insurance policy. They're going to go after you, not her. I have lawyers in high and low places, and they assured me of that. Tell your little friends, don't go out of here and get a private little policy, because we're going to kill them. Okay? They're going to go after you because they can get paid twice. Makes sense. Lastly, for any incident report, are we here? I need you to hear me. For any incident, SIRS, Sentinel event report your ass make, your girl, this your girl over here,